Imagine a highly contagious and potentially life-threatening disease that was thought to be nearly eradicated in the United States, making a shocking comeback in a state that hadn't seen a case in over 2 decades. This is exactly what's happening in Alabama, where the Alabama Department of Public Health, ADPH, has just confirmed the state's first case of measles since 2002. But here's where it gets even more alarming. The case involves an unvaccinated child under the age of 5 who contracted the disease while traveling outside of the United States. This raises important questions about the importance of vaccination and the potential risks of not being protected against measles. The child, who is from North Alabama, did not attend daycare or school, which has helped to prevent the spread of the disease to others. However, health officials are still urging parents to be vigilant and to ensure their children are up to date on their vaccinations. Measles is a serious viral illness that can spread quickly through the air when an infected person coughs or sneezes, and its symptoms can be severe. Typically, symptoms appear 1 to 2 weeks after exposure and can include fever, cough, runny nose, red eyes, and a distinctive rash. Dr. Karen Landers, ADPH Chief Medical Officer, is emphasizing the critical role that vaccination plays in preventing the spread of measles, noting that unvaccinated individuals have a staggering 90% chance of becoming infected if they're exposed to the disease. The measles, mumps, and rubella (MMR) vaccine is highly effective, with a 99% protection rate after 2 doses. This is why health officials are encouraging parents to take action and ensure their children are vaccinated, which can be done through pediatricians and county health departments. But what about those who are most vulnerable to the disease, such as infants, immunocompromised individuals, and the unvaccinated? The ADPH is urging parents to contact a doctor immediately if they suspect their child has measles or has been exposed, as prompt medical attention can make all the difference. And this is the part that most people miss. Vaccination is not just about protecting oneself, but also about protecting others in the community who may be more susceptible to the disease. So, what do you think? Should vaccination be mandatory for all children, or should parents have the right to choose? We'd love to hear your thoughts in the comments. As the first confirmed measles case in Alabama since 2002, this incident serves as a stark reminder of the importance of vaccination and the potential consequences of not being protected. The ADPH is taking this case seriously and is working to prevent further spread of the disease. But here's the question. Are we doing enough to prevent the spread of measles and other vaccine-preventable diseases? The answer, it seems, is complex and multifaceted. On one hand, the MMR vaccine is highly effective and widely available. On the other hand, there are still many individuals who are not vaccinated, either by choice or due to lack of access. So, what can we do to improve vaccination rates and prevent the spread of measles? Perhaps it's time to rethink our approach to vaccination and to find new ways to educate and engage the public about the importance of this critical public health issue. Whatever the solution may be, one thing is clear: the return of measles to Alabama is a wake-up call that we cannot ignore. We must take action to protect ourselves, our children, and our communities from this highly contagious and potentially life-threatening disease.